the significant healthcare challenges faced at the moment is significant ED overcrowding. The emergency departments are full and ambulances are parked outside hospitals for hours and hours with patients on stretchers. Currently, the process is that the ambulance paramedics drop the patient off at the triage area, where a triage nurse or a streaming nurse decides, based on a very short history and observation, where the patients should go. Is it to the resuscitation area, the general cubicles, or the fast track, the less critical area? We hypothesized that the paramedics might be just as safe and accurate in making this call as to where the patient should go, not only because the healthcare professionals, but also because they have that added value of having seen the scene, been to the patient's home, and also identified the trend in their presentation over the last hour or so that they've been with them. We stood outside the emergency department and waited for ambulances. 500 ambulances that came. We asked, where, if you had to make the decision, where would you take this patient? Resuscitation, general cubicle, or fast track? And out of those 500, we then went and saw where the triage nurse decided that the patient should go. In over 85% of cases, the paramedic and the triage streaming nurse decided on the same area. And in the cases where there was a discrepancy between what the paramedics and the streaming nurse decided, only 4 cases were of some clinical significance. So out of 500 cases, the paramedics and the streaming nurse can safely send the patient to the correct area in more than 99% of cases. We think this is very significant because it reduces one step in the patient flow through the emergency department, and any steps that we can safely remove is a cost saving and an improvement in the flow, which ultimately hopefully results in improved patient care and more resource allocation to the appropriate areas. So what are we going to do with our findings? Further educate paramedics in some of the key concepts around in-hospital streaming and triage decisions, and then implement it into the IT system, so that when the paramedics give the hospital a heads up about the patient coming in, that they are also at that same time saying which area within the emergency department they believe the patient should go. And we believe this will have a great impact on the patient flow through the ED to help mitigate some of the current issues around significant ED overcrowding, because that's very unsafe.